there, my name is Ben Chateau. I'm a physical therapist, an orthopedic and sports conditioning specialist. Today's topic is on low back pain. I know there's no shortage of information out there on low back pain. In fact, it's the #1 reason people go and see the physician. It's estimated that up to $50 billion a year is spent just on treating low back pain related conditions. Now, the problem is there's plenty of information out there on low back pain, but nothing really specific for low back pain in athletics and how to prevent low back pain for those that are more athletic, tend to run, weightlift, participate in CrossFit, whatever it may be. So my goal was to put together some information that was evidence-based, anatomically and physiologically accurate on how to deal with the common problem of low back pain. What are the risk factors, how to prevent it, and unfortunately, if you experience low back pain, how to treat it acutely and how to treat it chronically if you're one of those millions of sufferers from recurrent episodes of low back pain. So the first thing we're going to discuss today are what are your risk factors for low back pain. The good news is weightlifting, CrossFit, running, sports, whatever it may be, does not increase your risk of low back pain. However, there are a lot of things that do increase your risk of back pain. The #1 thing is smoking. Smoking really increases your risk of low back pain. The reason why is smoking causes really affects your body's ability to absorb nutrients and to provide those needed nutrients into your tissues. So when you smoke, it doesn't allow your body to heal properly. In fact, some of the research suggests that when you look at orthopedic surgeries for the low back, if you're a smoker, you have a 50% failure rate just because you're a smoker. So if you smoke, you need to stop. Now, once you eliminate smoking as one of the top risk factors for back pain, the other major risk factor is sitting. We all sit too much, or almost all of us sit too much. Sitting is our #1 problem in Western America or Western Europe and those developed countries. Sitting, not only is sitting bad, but we tend to sit really slouched, which puts us in this flexed position. Now you keep that flexed position over a length of time, 1 hour, 2 hours, 4 hours, 8 hours in a day, it starts to add up and puts a lot of stress on your tissues. A real common example of how this works is thinking of your finger. So if you put your finger in an extended position like this, you can hold that position for a minute, 2 minutes, 5 minutes. What happens when you hold it for an hour, 2 hours, 4 hours? You kind of get the idea. Your finger's not going to be too happy with you, and your back's no different. But instead of your finger going like this, you're putting your back in this slouched position. So whether you're standing slouched, sitting in a flexed position, that adds up over time. Sitting is not something that you would normally find in other undeveloped countries, and interestingly enough, they don't suffer from the same episodes of low back pain. In fact, they don't have the knee pain, the hip pain, back pain, or even constipation that we have, and it's because they don't sit. They squat. So one of the big risk factors to eliminate in your life is sitting. Other risk factors include pregnancy, being male. Men tend to have higher episodes of low back pain than women. Women tend to get more headaches and neck pain, so it all kind of evens out. Other risk factors include overtraining. Being too fatigued and too tired when you're trying to perform an exercise is a great way to have an issue with your technique that will cause you to change your normal movement patterns, and that's when you end up hurting your back. So if you're trying to lift a weight that's too heavy for you, it's very difficult to maintain that proper technique. Something else to consider is if you can't perform the technique with a lighter load because you're limited in your range of motion, whether it's your pelvis, your shoulders, it doesn't really matter, but if you can't perform the technique with the proper range of motion without an excessive load, imagine what's going to happen to your body when you try to add that extra load to the position. It really predisposes you to injury. So in the actual guidebook, it discusses all the other risk factors for low back pain in a lot more detail. But those are some of the ones that we need to look out for. And today, when we talk about prevention strategies, we're really going to look at how to avoid some of these problems, including fatigue, technique, making sure the spine's ready for the activity and the movement you're going to ask it to do.